All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is our third show for today. Thank you very much for being here. And I see already Loretta is actually first in my window. And then rubies are red, then Steve, and DDS, Doug, Mercy, Carolyn, Doug, Top 10, Loretta, Redox Bean here. Welcome, Redox Bean. Okay, so here is the link again to claim your title. So I have asked them to make one more change in this feature, and that is if for some reason you're not able to get your title and you want to see what titles have been already given, there would be one more button below here that would allow you to see the titles that have already been assigned. Guess which title I claimed the first of all. That was my privilege because it was not yet shared with others. I took the King Bean title. So tell me this, is Doug here yet? Mary, hello, welcome. Paul, hello. Tess, hello. Jenny, passing time in Texas, and welcome to everyone. So was it scary? It is actually not scary. I don't know why did they do this study, and if they did it, why did they confine it to +7 days? But I think and actually +7 days is fine, but why did they limit it from 5 to 14, 7 to 14, instead of continuing, let's say 7 to 20 or 7 to 1 month? I don't know why. So that was interesting for me. But that got a lot of news cycle. What I can't imagine is why sites like routers and they were not able to go and check and get some more data and make sense of it. It was just huge news everywhere. So let's say Stephen Chaim Lindenblatt says, does caffeine stop vitamins from being active? No, it does not. Absolutely. Too bad they didn't design more longer term. Absolutely. Why to go from 7 to 14 days? Now, if I wanted to be a conspiracy theorist, I would say that because the 7 to 14 days window gave them the data they were looking for. And then when they went after the 14 days, that data did not exist. So they just chose that window that allowed them to create this sensation. Gaurav Shah says, how protected is a person who has had COVID-19 10 months back against newer variants? I would suspect you're saying. So the reinfection cases are so low, that it is very difficult to see if the previous infection is helping or not. My thinking will be if newer variants were that bad, then we would have gotten almost another global wave, and that would have been SARS-CoV-3. That didn't happen. So I think that protection is still there and is strong. Zelena says, good evening. Good evening, Zelena. Hi, Charles says, hi, 78th. Hello. Doug says, not scary. So that's what I wanted to ask you. Was it scary? Al says, you are King Bean. Thank you. Margaret says, back. Welcome. Okay, so let's see more questions. Cindy Glasgow. Cindy, you came in after long days. Hello. Mary says, you deserve a crown. Thank you. Janet says, King Bean, Oot. Thank you. All right, so there's a question here. Renee says, did you see 60 Minutes last night? Very interesting about the type of sensor that detects virus under the skin and can alert the doctor for early treatment. No, I did not. That will be interesting to see. I would check it out. Lisa says, Tom Johnson, Dr. Ron Brown was very interesting on trial site news. Oh, I'll check him out. Bonk bonk. So first of all, bonk bonk, thank you very much for setting me up for Twitter on Twitch. I haven't yet put all those creatives and pictures and everything, but thank you. I'm a long hauler and was re-exposed 10 months in. Tested negative, but had a mild relapse. That's interesting. And so the long hauling is still continuing. So Mishkat Joha says, sir, tell something about COVID vaccine-induced thromboembolism. Mishkat, do me a favor. I have done a video that says AstraZeneca vaccine causes clotting, a German research. Please watch that, and I have discussed it in there. WHO says it's happening. WHO is all over the place. For them, everything is happening except ivermectin. Bird says, my second shot of Pfizer is 3 months after. Wonder efficacious, is it still then? Yes, so it is actually seen that the later the vaccine is taken, it is actually more efficacious. Chen Chang says, Dr. Bean, thank you for the breakdown. I would like your thoughts on the comparison of the Pfizer study you broke down versus the Janssen's vaccine efficacy, which was tested in South Africa. So I haven't actually looked at that. Let me take a note and I will. So Janssen vaccine efficacy in South Africa. And I saw a super chat as well. So whoever sent the super chat, Westfield, thank you very much. So did you note this, that with the demonetization, many of the cool beans said that, hey, why are you so concerned about demonetization? They're just not going to pay you. So what? Why are you after the money? That was the kind of implication in there. But the thing is this, let me share my screen for a second and explain how this actually works for them. So here is what happens. And I know that you know it, it's just to be on the same page. So let's say here we have YouTube algorithm, right? So this algo, their digital brain, this algo's job is to match a video to a person who may be interested in it. So let's say the algo decides that somebody here wants to watch Dr. Paul Marik or Dr. Corey or Tess, or let's say ivermectin, something like that, fluvoxamine. Here it knows that Dr. Bean has it. Let's say another XYZ channel has it, another channel has it, ABC. So the algo has to decide out of these all, which one to show. And of course, YouTube's position is that, hey, this is all AI. We're not doing anything. Our hands are clean. This is our algo. It works on this thing. But here is what is an interesting way. They do a dog whistle to their AI. And the dog whistle is this. They said, okay, you know what? Dr. Mubin's Dr. Paul Marik video cannot earn dollars. So this is what they do manually. So for those 54 videos, I received emails that we did a manual review of your video and we decided it is not right. So this somebody sat down and went over all of our videos, or majority of them, found those keywords and then took them out. So now let's say this is another video of Dr. Paul Marik, but not talking about ivermectin, maybe talking about lungs. And this is another video of Dr. Paul Marik 10 years ago talking about respiratory system and dexamethasone. This algo now is going to show something to this person. And when it is going to show them a video, that video can play an ad. And when that ad is played, YouTube would earn something, some dollars from that ad, plus the person whose video is going to be played, they would earn something as well. So because they have removed my monetization, algo knows that the basic job is that while it is entertaining you, it has to earn for YouTube. So out of these three, it is already decided that Dr. Bean's video cannot be shown or should not be shown because it is not going to earn anything. So it's going to pick up this video or this video and join it to the viewer. So in 4 days of monetizing, what they did was they took all of my most watched videos and they demonetized them all, 54. The result is that within 3-4 days, so fast, I used to have about 200,000 views on within 48 hours, 2 days. That has come down. Today it was 110,000 views, 50% reduction in viewership. And then similarly, rapid decline in the subscriptions, because as more people don't watch, they don't become subscribers. And similarly, rapid decline in all the other parameters. So this is equal to dog whistling to their algo to say, choke this person's account, without they saying that we are choking it. They would just demonetize it. So this is such a interesting way for them to do this. Okay, so Loretta says, no, so please, when I started this, I had always been of this opinion that I was doing it as a gift. So this is still the same way. I'm just explaining what I did was, on my business side, I paid less attention and I paid more attention here. I just have to focus a little more on the business side as well. So that's fine. All right, let's see. John Ria says, I take ivermectin every week, and my wife and family, who all got the vaccine, are insisting that I get the vaccine. Should I get the vaccine? Signed, family prayer. So I have been always very clear. I am a pro-vaccine person. So I ask everyone to get vaccine. I got vaccine too. I took my ivermectin as well. So today I felt little congestion, and I went ahead and I took my black seeds and honey and vitamins. I have taken ivermectin as well. So, and I have vaccinated as well. So that is my position. That Christina says this, it seems a bit like vindictive move on YouTube. That's correct. But the thing is this, you can't, one, even if they did it by doing discriminating and saying, we just going to close down Bean's channel, you still cannot do anything about it because it's a private company and they can decide to do what they want with their platform. But this is a very interesting way to bring somebody down, that they can still say our hands are clean. We just demonetized it because we don't think these videos are reasonable. But we didn't do anything to the account. And the account just starts 3 days and it got decimated. Margaret says YouTube's behavior is criminal. Yes. More sad thing. I mean, this is, yes, one sadness that there is a reduction in the kind of choking the account itself. But more sad is that they are doing it for the topics that are actually not conspiracy theories, or we are not spreading things that are blatantly wrong. We are talking about ivermectins. We are interviewing Dr. Paul Marik, Dr. Tess Lowry, Dr. Corey. So all reasonable people, and they have done a lots of contribution to help save people and save them with simple, easy to access things. And may I say this, that myself, Dr. Paul Marik, Dr. Corey, Dr. Tess Carvalho, we are actually not the ones who brought this information in the first place. This research was done by Australian doctor. Then the first brave step was taken by Bangladeshi doctor. From there, it kept becoming bigger. I think in the US, I was one of the first one to talk about ivermectin. And from there, I spoke about it in March, April timeframe, which was taken down. And then Dr. Paul Marik and team, first they asked me that, hey, can we take some of the slides from your talks? And then in November, they just kept moving it forward. Meaning, We are not even the first ones to present this. Even then, they're just kind of punishing people. Anyways, enough of the. Yes, Bangladesh had done a good job in this one. Australia had done a good job as well. If Australia had not done it, and then Bangladesh had not taken this, Dr. Alam from Bangladesh had not taken this step, then we would be not probably talking about it. Nancy Park says, how about if we go to the YouTube homepage and put ivermectin in the search bar? If they know people are looking for that info, maybe we can turn it around. They can. So what they do is you can still look for ivermectin, and they would now continuously decide. For example, I have one more person whose channel's ivermectin is presented, but he only has one video, and the other videos are not there. So they're looking for folks like me who have 54 videos, a bunch of them about ivermectin, I think 12 or 13, then Paul Merrick, and then Corey, and then Tess, and then meaning there is a whole structure present to support this ivermectin, and that is what they are kind of smothering. Raj says, does the vaccine increase the sugar level for a few weeks? It can cause inflammation, just like my congestion here became more pronounced. My wife's knee joint aches became more pronounced. It can cause inflammation, which may put stress on the body to create diabetes, but this is not or increase the sugar levels, but this is not a known side effect. Scarlett says, if you take ivermectin, will it help with H. pylori? No. Dr. Drbeen says, greetings, Beans, greetings back to you as well. Gold Country, how are you doing? Overall interest in anything COVID related on YouTube will decrease because everyone has weird. Yes, but this is very different. 4 days ago, we were actually, the viewership nowadays had actually increased because of folks trying to understand more about ivermectin. And then 4 days ago, the demonetization occurred. And after that, it just went down like this. That is correct, Simple Garden. LF says, I've been taking ivermectin weekly for almost 4 months now as prescribed and have had absolutely no problems. Yeah, so I've been taking it for some time, no issues. Mac Borake says, how do we respond to friends who insist the vaccine changes our DNA? Where does that come from? So this is the folks like Kahil, who said that once you take the vaccine, you will become a mutated organism. So I had done a talk about that to say it does not. Secondly, I have done one more discussion, which is, will the vaccine change our DNA? In which I explained scientifically how the mRNA gets into our cell and gets processed. And that process is just similar to any other processing, and why it cannot become DNA. So I've done that discussion, if that can be. What I've seen is that if somebody is not going to agree to that, then this is called the confirmation bias. They would reject or just mentally dismiss anything that goes against what they believe, and they would try to pick up all those pieces of information that strengthens their belief. Colin Hamill says, what is everyone's new bean name? I am Rubber Bean. Very nice. Welcome, Rubber Bean. Yes, so my next dose is on 5th May, I believe. Lizzie says, new subscriber. Lizzie, welcome. You are a cool bean now. Yes, I received Moderna's first dose, and yeah, I don't think that they needed to silence me, but anyways, they are trying to. What I thought was interesting was the way they did it. was just demonetize a bunch of videos. The top videos, demonetize them, and all of a sudden the algo stops sharing our videos because algo knows I'm not going to earn anything with them anymore. Luis Veronica says, can the Pfizer vaccine cause numbness and tingling in the mouth, lips? So the um, short answer will be yes, not a known thing, but this has the facial and neurological things have been reported and they were in the trial as well. I'll give you my wife's example. She had Johnson and Johnson, and on the way back when I was bringing her, she said my tip of the tongue has started tingling, and then she said about 1/3 of the interior part of the tongue had become numb, and then she said she had felt a lump in her throat, but this all went away within a couple of days. Marcio says, hello, Dr. Bean. My wife had taken first dose of AstraZeneca here in France. Her second dose probably will be with Pfizer. Okay, so first AstraZeneca, second Pfizer, or Moderna. Will it make her vaccine efficacy lower? Ideally, no, but there is no data. I have done scientific discussion that in theory it should not, because every vaccine at the end of the day is producing spike proteins, which is causing the immune system to get ready. And then the booster, the second dose comes in and kind of boosts it further. The only difference will be what was the first dose needed and what is the second dose needed. That is still not known. UK is doing some trials of mixture. I think it will be okay. That is my personal opinion. It is not data based. I don't have data to show for this. Scarlett says, have there been any studies on indomethacin and COVID-19 or ACE2 inhibitors? I had discussed some of the ACE2 related studies in the beginning, about 5-6 months ago, that there is not much difference. I have not seen any recent studies. Liz says, how often do we have to take the booster shot? And she has the starry eyes as well. So, Liz, ideally, if the shot, if the variants do not become too different, then the boosters should not be needed. Originally, the immunity lasts for SARS-CoV-1 for 2 to 3 years and T-cell based immunity for even up to 10 years. So ideally, the immunity should last longer. Roger says, what is happening in Chile as they move into flu season? 20% population are vaccinated using 10% Pfizer, 90% Sinovac. They mainly have the Brazil variant. Let's see. So if I go here and I say worldometer, so Chile is not doing good, as we can see here. Now the question is, what is their vaccination status? Bloomberg. So if I say Chile, so they are 31.5% population covered. So this is a similar thing that with Israel as well, which that study I discussed today, they mentioned too, that in this early time of the vaccination, the viruses are not contained easily. But as the vaccination goes further, then it is better. So 31.5% of the population coverage. Let's see here. 24.4% full and 38.6% one dose. So this is not yet sufficient to retain or contain the virus, and we are seeing the second dose. The vaccination has to go above 60% to be able to do something. Michelle says, can we check on Lima, Peru cases and vaccination? So let's see. I hope that is the way. So here, Peru is not doing good. So they had a good control here, and now they are in third wave and kind of wobbling but staying up. And the deaths are following as well, not good. And how is their vaccination? Peru is here, 1.6% vaccinated. So that's nothing. So not good. LG says, question, is Chinese vaccine going the best with less side effects so far? So my thinking is that Chinese vaccine, Sinopharm, had been doing better from my observation of a few cases. Although yesterday or this weekend, I believe there was lots of another set of news where Chinese CDC's head or some official had come out and said, we know that the efficacy is not great. And then the next day he took it back and said, what I meant was following. So far I've seen the efficacy to be okay, but that is in a very small group of friends. The overall bigger numbers are still not given. That is a problem with these vaccines, that the numbers are not there. So let's see. Benjamin says, Dr. Mubin, any chance to interview Dr. Ron Brown regarding reporting bias in COVID-19 trials, or is it too demonizingly controversial? No, I can talk about it. Is he controversial? So I already have the 50% of the YouTube account taken because of ivermectins and Dr. Merrick and Corey and Tess. So we can have the remaining 50% go with Dr. Brown. Is he too controversial? Let me actually write it down. It would be good to talk with him. Dr. Ron Brown from Canada. So I'll ask my team to reach out to him. Joe says that if ivermectin crosses the blood-brain barrier, what would be the symptom and is there any treatment? So usually dizziness, headache, and then seizures can occur. According to Goodman-Gilman, the book of pharmacology, they say that discontinuing the drug should help improve it, but in rare cases, it can cause permanent damage. Most of the people who may have some headache or those things with it don't have that problem, but discontinuing or increasing the duration between the doses can work. When we spoke with Dr. Paul Merrick about headaches with ivermectin, he said that's okay. They usually subside after use. Hey, Luffy. What happened? What? You didn't get your food? Luffy? What? Come here. What happened? Is there a cat outside? Yes? Where? Guys, can I just quickly see what Luffy wants to show me? I'll be back. What are we seeing, Luffy? And in this process, I brought Luffy here as well. Luffy, look at that. Okay. He was only interested in showing me something. Yes, absolutely. William says, do you feel Symbicort? So he's back. Let me open his door. 1 second. HFA version of budesonide would be relatively as effective as Pulmicort used in nebulizer. I already get prescribed Symbicort, but I price Pulmicort 500. Yes, you can try that. Ideally, yes, I think it would work. At the end of the day, it is steroid, so it is not a different molecule. Thank you very much. Luffy wants ivermectin, yes. Alexandru Valley says, I had my first jab of Astra vaccine 1 month ago. What set in 2 weeks I will have my second dose? What a blood test should I do before and after? So, Alexandru, important thing is that any clotting related issues, they normally occur between 5 to 17 days of the first dose. And if they don't occur with the first dose, they are not observed after second dose at all. And it makes sense. And the reason for that is that if the drug has not poked the immune system to produce those specific antibodies against platelet factor 4, then it would not do it in the next dose either. So ideally, it should not matter. But if you wanted to get your blood test, the problem is that the hit test or the blood test for hit platelet factor 4 antibodies can only be detected when that is happening. So you can probably get it. It is Luffy who just going back and forth again and again. You can probably get it, but I'm sure it would come back negative. Luffy is demonetized, yes. Somebody wrote Luffy is demonetized. Potato Chips says, are there any contraindications in taking the vaccine aside from allergic reactions? I would say what happened in Netherlands, that some folks were very weak. And when they took the vaccine, the diarrhea and the nausea and the retching and the myalgias and fatigue combined, their body could not handle it, and they died. So that means it's not just the allergic reactions, the body's capability of handling the side effects is also important. Delilah Davis says, inhaled steroids also to be DC before wax. How many days to discontinue steroids and Tylenol before wax, please? So the question is that why were somebody taking steroids, especially inhaled? Inhaled steroids, for example, for breathing issues should not be discontinued. Vaccine can actually exaggerate some of that inflammation that may be related to asthma. So if I have a patient and they are taking steroids, I would inhaled steroids, I would not discontinue it. That can be dangerous. If they have other steroids being taken, then it would really depend that have we immunosuppressed them or immunomodulated them. So what is the drug dose and therapy and the duration? So based on that, there may be a reduction in steroids necessary or discontinuation. So Delilah, that means the answer cannot be simple. And of course, I cannot give an answer for a specific person, but for an inhaled steroid, if I have a patient, I would not stop it. Truth Teller says, so Truth Teller, we have a truth seeker as well. So maybe you both should meet. Truth Teller says, I am 20 years old, no pre-existing conditions. I took one shot of AstraZeneca since 7 weeks, but government is not giving me second, yet I am considered immune. So here's the deal. It is seen that till 90 days, the efficacy continues to improve just by one dose. So if you are, let's say, 7 weeks out, about 2 months, it is actually not bad from AstraZeneca UK trials. Here is Truth Seeker. I just love Luffy. So thank you very much. Fran says you saw Luffy, now paw the button. Yes, the like button. Okay, so let's see. Daisy says, how long after having the virus do you have to worry about blood clots? So the time duration, some reports said 3 days to 17 days, some said 5 to 17 days. Let me actually make this clear to us cool beans. Let me draw it. You would actually, it would make sense. Look, what happens is the following. And let me take down the note. This is what happens. So let's say vaccine is given here. This is the vaccine. Vaccine will be picked up. So let's say AstraZeneca or something. Eventually, it would make the antigens. Those antigens will be picked up by, let's say, macrophage or dendritic cell, right? So something like that is going to pick up this vaccine. Then it is going to process that vaccine, present it to the immune system cells, correct? And we know this, that there will be a naive T cell that would go T helper 2 pathway to go B cell to plasma cell, or T helper 1 pathway to activate the cytotoxic T cells, correct? Cytotoxic T cells. And we expect that the vaccine would do this phenomena to present the antigen that is the viral antigen, the spike protein antigen. So the antibodies that are produced are going to be the spike protein antibodies, correct? That's what we expect from the vaccine. But for example, AstraZeneca or other adenovirus-based vaccines can, in some people, instead of just causing the antibodies to be produced against the spike protein, they trigger another set of immune similar pathways that result and activate B cells, which in turn make antibodies that work against the platelet. So this is the platelet factor 4. This is the antibody that goes against that. Now, you had asked the time. So think about it, just like this time, which is usually 7 days to 14 days for adaptive arm to become active. It is a similar time. So they are seeing this to be between 3 to 17 days. Because at the end of the day, this is still an adaptive arm trigger that has to make these vaccine antibodies, which have to attack platelet factor 4 plus the platelet, activate the platelet, and that would cause clotting. So this is adaptive arm triggering, and that can be anywhere from 7 to 14 days here, 3 to 17 days. Some reports said 5 to 17 days, and so on. But it is usually not immediate, except those people who may have had heparin-induced thrombocytopenia in the past, who already have these cells and these possibility to make antibodies, they may immediately make it. So it is contraindicated for anyone who had hit in the past. Liz says, which vaccines are known to give you blood clots? So from a clotting point of view, it is said that possibly adenovirus-based vaccine. Although I believe the Florida doctor who died of idiopathic thrombocytopenic purpura was not taking an adenovirus-based vaccine. I think he was taking either Pfizer or Moderna. So, but it is known with the adenovirus. That would mean AstraZeneca, that would mean Johnson & Johnson, Sputnik. These are all adenovirus-based. Mikaveli says, can you discuss complement immune system? Definitely. So we can do a quick chat right now, and then we can talk in detail later on as well. I had done one discussion in the past too about it. But generally what happens is immune system is made up of cells and proteins. For example, we know that we have NK, natural killer cells, and neutrophils and mast cells, and um, uh, macrophages and dendritic cells and helper cells, and T helper, and then B cells and cytotoxic cells, and so on. But then, for example, B cells make antibodies. These are proteins. Similarly, liver usually makes a set of proteins that also take part in immune function. And in those, there are two types of sets. One are something that are called acute phase protein, although some authors put the complements in the same thing. Acute phase proteins is that when the infection occurs, our liver starts helping and makes some proteins that are necessary. Similarly, liver also makes complement proteins. These are proteins. Their job is to become activated by the antibodies usually. So let's say there is a bacteria. This is a bacteria. So this is a bacteria. Some bacteria was very happy, is in our body, and kind of is lurking around, having fun, and thinks that it is found its life's purpose to live in us. Now what happened was we became very upset. We had the immune system activated. That caused the antibodies to be produced, and the antibodies went and bound to some antigen patterns on this bacteria. And this is not true just for the bacteria, virus, and so on. We know why antibodies are. These antibodies, this constant part of theirs, it has biological function, and what it can do is it can activate the complement. And I have done this in detail in the context of COVID, that when the complement protein becomes activated here or attached here, it would create a cascade of activating other complement proteins. Normally, the activation of the complement, if you see here in my window, I have this little cream. And if I imagine if this was a complement protein, usually activation means to split it into two pieces, and one becomes A and one becomes B. A usually for active type, and B becomes B. So then that active part and the other part, they go on doing other functions, and this continues to happen eventually to a point that complement C5, 6, 7, 8, 9B, there is a bunch of complement proteins that become collected together. They become this little pipe-like structure, and they get inserted into the surface on which this whole complement activation was happening. This puncture, this pipe, this little piece gets stuck in the wall of the bacteria, and from there, the bacteria or virus, but usually bacteria, from there, the things from the bacteria, they start falling out, they start pouring out. The material, and this could be our own cell as well if the antibodies start sitting on that. And that gushing of the things outside of that would cause the bacteria to die. So this is how complement ends up killing the cells or the bacteria or the fungi or the viruses and so on. This is the function. So in a nutshell, this is how complement system works with my art. Eddie Berto says, can you relax once you have had the Moderna vaccine? Second dose taken 3 weeks ago. Also, should I still be taking ivermectin after the vaccine? And does ivermectin interfere with the vaccine process? So many questions. First, generally, yes to the first part. Ivermectin necessary after the vaccine, totally up to you. I think that after the complete immunity, ivermectin may not be as necessary, as long as you can, as long as this is okay with you, that if you still get ill with COVID, you will not be hospitalized or you would not die of the COVID related reasons. So then if COVID happens and there is some mild botheration and couple of days of discomfort, common cold like, then that is the chances still. And ivermectin also has 74% or more efficacy in case of active disease, I think even 90%. So neither is vaccine complete, nor is ivermectin, nor is vitamin D's. So a combination should be there. Um, I intend to continue to take ivermectin, but on a lower frequency. And maybe once I have reached both dose, and then 2 weeks after that, maybe once a month, or maybe when I feel that I am exposed or I have gone out and met people, I might take it at that time. So this is, maybe I'm extra careful, but that is how I would look at it. Christine Bra says, since budesonide is a steroid, is there a risk in using it early in the COVID-19 disease process? Might it permit viral replication? When and how is budesonide treatment useful? So very good question. I'm going to give you multiple answers. The first answer is yes, there was a study that showed that coronaviruses, when we take steroids, then clearing the coronaviruses from respiratory system reduces or decreases the rapidity of clearance. So they stay longer in our respiratory system. There's one study, and I had actually discussed that study. Based on that one study, CDC, FDA, and general medical population try not to use steroids in the early parts of the disease. So that is one data point which is backed by one study. Then is the experience. And there is no study. I think there is a budesonide study now. I should talk about it. But from an experience point of view, now I'll give you some experiences. One, in the US, I had talked about budesonide with that doctor as well, who had been using it, and he used it quite with success. I remember I had asked him a question. I had said, do you use it from the beginning? And his answer was, and I still remember it because I thought, that is an interesting answer. His answer was, I don't, but some of my friends who know this, they use it in early time, which kind of told me that he may have been making sure that he is not saying that, hey, you should use it from the beginning. So he said his friends have been who have great success. So this is the second data point. Third data, and he said I use it a little later and it is really efficacious. Third data point is that I have always seen budesonide used 3-4 days later, but not right from the very first day. Even here in the US, by my friends, and they say it really helps the patient to have better breathing. So there are doctors who actually start third, fourth day budesonide just to make sure that the patient doesn't go through the breathing problems. The steroid use I have done when I feel that somebody is old and they have comorbidities and they might end up in a lot of issues or becoming a long hauler, then I give them not budesonide but systemic steroids about 7-8 days in their infection. So this is the general experience that I've seen. To answer your questions, I think that there are people who started from the very early on, and then there are doctors who started later on. So it would depend upon the doctor. Steve says I should get going. Good night, all. Good night, Steve. Thank you very much for being here. Colin says, dieting a few weeks after a vax, bad idea? No, totally good. It has nothing to do with that. Just have proper nourishment. Lizzie says, how much of ivermectin can be too hard on the liver? There is no such study to say that this is the upper limit where after that liver cannot manage it, but still liver would have a upper limit. We just do not know. So I'm just seeing the question. Samina has a question. I'm so sorry that ivermectin is omitted from the national protocol of COVID. Yeah, we all are very sorry. So not only it is omitted, but the folks who talk about it, they're punished as well. This is a similar thing that happened with hydroxy too. And then it seemed like these folks had given up on doing this, but now they have started doing it again. This started since WHO. Peggy says, what do you think of cod liver oil? So we have done a discussion that actually fish oil is very, very valuable in reducing COVID-related chances of severe infection and generally for inflammation. So it is valuable. Is it what percentage of protection does it give is not known. Tandon Deepak says, what are the chances of COVID-19 seriousness with smokers? We know that it is in one of the risk factors, but I do not know exactly how much of the risk it would create. MS Silver 41 says, how does vaccine antibodies work differently than, say, Hashimoto's antibodies? Hashi antibodies continue to attack the thyroid cells. Why don't vaccine antibodies continue to attack our cells? So, MS Silver 41. This is a question that I was waiting for 1 year. So let me explain this. It is actually a beautiful concept, and we had not talked about it, and here is why. Or maybe we talked about it every here and there. So what happens is, imagine we have a set of B cells here, 1, 2, and 3. And imagine this is B cell, imagine this is T cell. And all of them have, let's say these are B cells, and they have receptors to bind with the antibodies. So imagine this B cell, let's call it A. It has a receptor that would bind with, so ideally the B cells receptors are called IgA for the medicos here. Sorry, not IgA, IgD. And that means their structure is that of an antibody. And we are talking about this binding site here. So the binding site, the one that connects with an antigen, is of varying shapes. So let's say this cells, this is the shape of this, what is that? This binding site. So that means that, let's say this is the structure, and it can work with this kind of a rounded antigen. But this structure cannot grab, let's say, this pen. It cannot grab the pen. On the other hand, imagine that this is another B cell, and this cell has a receptor that has a structure which is like this. And this structure would allow this receptor to bind with the pen. And then this one has a B cell binding site, or immunoglobulin D's binding area, which is like this. So let's say the area is structured. And you can ask me that, hey, why does it have this structure? And this happens because of the protein structure here and the electromagnetic forces here. And these forces are set up in this way that a specific structure is formed. So let's say here, this B cell, let's call it C, this is B, and this is C. This B cell C will bind with some surface that has a star-like protein on it, or a star-like epitope on it. So let's say this cell, let's say it's a bacteria, and this bacteria has this pattern, which is star-like pattern on it, and this pattern would fit well. So let's make it this way. So this C cell can bind with this pattern, but B cell cannot bind with this pattern. A cell cannot bind with this pattern. So imagine now that this is thyroid tissue, and this is a pattern there, and this is a B cell that is making antibodies. So because its receptor is that type, the antibodies it would make would also have the same pattern. So that antibody that it would make will come and fit here, and that is how this B cell can attack the thyroid. On the other hand, imagine that this B cell has a pattern here which is good for spike protein. So let me make this pattern a little different. Let's say this pattern is structured like this, and it is good to connect with the rounded spike protein structure. So this B cell can make antibodies that can bind with this kind of a structure, and that is the spike protein from the SARS-CoV-2. That means every B cell and every T cell can only bind with one antigen or epitope, and they cannot bind with other epitopes. And they have to, every pathogen, SARS-CoV-2 or a body's tissue or a fungus or a bacteria, they have a number of patterns on them. These patterns are something that gets matched to our B cells or T cell, but one pattern of 7 to 12 or 12 to 25, depending upon B cell receptor or T cell receptor. There's lots of depth in this discussion, but I'm just keeping it high level. So these patterns are present, and the cells can recognize the pattern that fits their receptor, and that cell would become activated. And that is how immune system can hone in to a specific thing and attack that. It's a beautiful mechanism. I had actually asked a question a few days ago that when I got the vaccine, my throat had some inflammation before, and that inflammation just continued to become exaggerated. Why? And that is another question that I think some cool beans can answer me. Otherwise, we'll discuss it. That's another question I'm waiting for a year for someone to ask. So this was a great question. Thank you. And I hope I answered it in a way that makes sense as well. So how about we stop? Absolutely. Doug Gross says got epitopes. Correct. These are exactly the epitopes. So Aliji, I have actually started the other channel, and please tell me what would you like to discuss, and I would start working on that one. Barbara says, this is interesting. K4 Liberty says, is it okay to use Flonase after second dose because it has steroids? I have been using Flonase since the first dose, and I would continue to take it after the second dose. Most of these drugs that are inhaler type, their quantities are adjusted in a way that they cannot become absorbed systemically and cause issues. Nick says, if Novavax proves to be better against variants, might those that got the mRNA vaccine might not produce the same reaction to that vaccine. Variants. Those that got the mRNA vaccine might not produce the same reaction to that vaccine. Which vaccine? Novavax? Nick, I didn't get the question clearly. My apologies. Can you please? Okay, so diabetes it is. Let's start talking about diabetes on the other channel. This channel is being killed by YouTube anyways. We'll see what happens with this one. Daisy says, had 2 rounds of prednisolone with virus and pneumonia. Is this delaying my recovery? Yes. 2 rounds of prednisolone, just 2 doses of prednisolone or 2 therapies of prednisolone. It depends about your health, your body weight, the amount of drug steroid you took, the duration, for how long, and the load of other things. So short answer is, when you take steroids, you are going to suppress some of the immune system, and the virus and pneumonia would become difficult to, or a little delayed to be cleared out. But the question is how much, the quantities and how much of that. So maybe can't answer that until I know more. Doug says, go to Rumble. Yes, I think I need to do it. I'll tell you what kind of makes me scared of going. I tried to go to BitChute, and it was just so much work to download the video from here, from YouTube, then go over there and provide all the metadata that I didn't even get, even just to put 2 or 3 videos up. Many hours were spent of mine to put it up, and it was just so difficult. Okay, so Texas Max says channel name. So I had this channel. Let me show you. That other channel was, let's see, what was the channel? If you go to YouTube, I had actually made that in case YouTube becomes upset with me, I will put all controversial things there, and they can then take that down. But instead of that, this channel became the issue. So look, we are live here. So if you say Mubin Sayed, ivermectin, how does it work? Unfortunately, that channel also has this. So this is the channel. The channel is called Mubin Sayed. So let me see if I can have the channel, if I wanted to share it. How do I share this? There must be some place here which says share channel. I'm just going to take this one, this link, and put that here. So it is really Mubin Sayed is the name of the channel. That is where I'm starting. So if you see here, interestingly, ivermectin here, 55,000 views in a month, and the other one is 10,000. So I started it, and here we are. Rima says, eventually YouTube will realize. Yes, the word question is, while we are alive on YouTube or afterwards. So let's answer a couple of more questions, and then we break for today. Potato Chip says, is vaccination contraindicated if the patient suffered from myasthenia crisis few days before vaccine is given? So it is an autoimmune disease issue. It is not an allergic. So vaccines are generally contraindicated for allergic reactions. Vaccine can trigger immune system's reactions. So it will be difficult for me to say without knowing exactly the antibody statuses. Why don't you please talk with your doctor? If I was under this, I would want to get my statuses first to know if I can go for the vaccination or not. William Goff says, do you think Novavax in theory will be less reactogenic than others because it has no lipid nanoparticle or adenovirus? Ideally, yes, but Novavax also have an adjuvant called Matrix M, which is known to have caused issues in the past as well. Cool. So Margaret says, thank you, Dr. Bean, and all cool beans. You're very welcome. So how about we stop for today and we'll continue. Rima is saying, how's Mrs. Bean? She's doing fine. Her headaches had subsided 2 days ago. Her knee joint pains have had subsided. This morning she said, I have knee joint pain once more, but she is generally much better. After the vaccine for 2 or 3 days, she could not even walk well. I just keep getting this inflammation. So I think what happens to me is wherever I have allergy, and that causes my upper respiratory tract to become congested every morning when I wake up. And it seems like vaccine just keeps pushing that area. And there is a mechanism for that. I'm hoping somebody in the Cool Bean team would tell. William says, thank you for all you do. Thank you very much, William. Cool. So let's break for today. Please like, subscribe, and share. If you would like, just liking it, that would be good enough as well. And then if you would like to support this work, there are 3 links in the description. One is to buy me coffees. The other one is to become a patron. And then there's a third link to support this work in general. So thank you very much, and I would see you tomorrow.